I feel like Hello, everybody. We are live now. I'm Michelle Farrell. I am co-coach and co-founder of Straight Up Strong, and I'm here with my co-coach Tina Tang and our very special guest, Dr. Janet Yu, who specializes in helping runners be happy, healthy runners. So we're really excited to have a conversation with Janet tonight. And if you have questions for her, please put them in the comments as we go, or if you're watching the recording. And also, we'll just hit it off at the beginning. We do have a very special workshop coming up on April 17th. So everybody is invited to join us for that as well. And that is linked down in the caption here. So Janet, why don't you tell us a little bit about yourself, who you are, what you do, why you do it?
Okay, so hi, I'm Janet Yu. I got into running literally in high school, middle school, and I continued on in college where, of course, had some injuries, seeing my teammates have injuries, and really got interested in like helping myself and my teammates how to fix that, and that kind of led me towards the path of going into physical therapy. So I went to USC for physical therapy school, graduated in 2010, and just carried my passion for like running and injury prevention from then on. And so yeah, that's where I am now. And I think the thing that's a little bit different about me is I have some background in public physical therapy as well, so I tried to blend that into the way I help my runners with their injuries, because that area plays a big role in how you move and pretty much sets you up for successful running.
I thought that was what's really great about you as a PT is that you're not just someone who studied it, but you literally are a runner. Like, you've been running competitively, and I love that that's how you got into becoming a physical therapist to help people, athletes.
Yes, definitely. And of course, like, running is foundation for so many sports too. So even though I specialize, let's say, with working with track and field and cross country, I've worked with a lot of soccer, basketball, different types of athletes, because that is such a foundation in their sport. Yeah.
So our first question, because this is why everyone's here, I'm sure there's some interest in running. What's the number one kind of running injury that you see most often?
So the injury I see most often is probably like IT band syndrome. That is probably like the biggest thing that I see. And there can be so many reasons for IT band syndrome and how to like go about fixing it. But a lot of it, from what I gather, is an alignment, posture, and technique, which is what contributes to setting up the IT band for essentially an overuse situation. So yeah, that is the biggest injury that I work with. Yeah.
And then for anyone like me, can you kind of just give a general idea, like what they might feel to know that what part of the body?
Yeah, so the IT band is this big connective tissue that runs along the side of your thigh on the outside. And you would have IT band syndrome pretty essentially like if you have that like side leg pain, and sometimes that can go all the way down to the knee because it connects all the way down. So anywhere along that outer part of the thigh there is considered some sort of IT band irritation. Yeah.
Oh, that's helpful. It's helpful to know for anyone who might have that. Is it usually in all levels of runners, like beginners, even advanced? Okay.
Yeah, definitely. I see it across the board. And I think part of that is just because, the runners are running for themselves. So if somebody's running 12-minute mile pace and that's at their fitness level, they're still set up for injuries because they're at their personal peak of fitness, versus somebody who might be like a 6-minute miler. They're pushing their peak of fitness, and so they're pushing their body. So you see it across the board. Yeah.
Interesting. And then one last question in terms of that injury. Is that something that someone can fix? Like if they, is it through exercise, like certain exercises?
Yeah, so you can definitely fix that with strengthening exercises, posture and alignment exercises and cues too. I think that if anything, that plays a really big role in helping the IT band feel a little bit better. And by the way, IT band stands for iliotibial tract. So iliotibial bands, yes. So you can really work on the posture and alignment piece. I think sometimes a lot of people have a tendency to do a lot of the strengthening work, maybe even do a lot of the foam rolling on the side of the leg, but fundamentally because their posture and alignment isn't the best that it could be, that they're still set up to where it's like a thing that they have to do every day to keep their injury at bay. So
gotcha.
Posture piece first.
So I know that when I started running, my first injury stemmed from the IT band and then in my lower back. And what I would try to do was just like mash my IT band with the foam roller. And I see that that's like something that people still will recommend, but then there's also on like the other end of like in everything with fitness, right? There's the people over here and there's people over here. And then usually somewhere in the middle is where we want to be. People who are saying, don't foam roll your IT band. Should we be foam rolling our T bands or should we be avoiding the foam roller in that area?
So I'm on the camp that you should not foam roll the IT bands. Honestly, the thing is, if you
feel like controversy,
right? If you feel like it's right, like if you feel like it's helpful, do it. And the main reasoning for that is because so with the IT band, a lot of those trigger points that you feel, because there will be like certain parts of it that is painful. Those little points can actually go back to the femoral nerve. So what happens is it's the femoral nerve piercing through the IT band that kind of comes out superficially. And when you're rolling on it, you're kind of smashing that nerve, and eventually the nerve will give up. And the IT band will feel better, and until the next day when the nerve is like, oh, I'm awake again. Like let's do this. And so usually I do like different techniques, actually decompress the area instead of compress, and the nerves like that a little bit better.
Oh, it's so interesting. So, I know what I wanted to ask, and I know you're going to go much more in depth in the workshop about exercises that you like for runners. So since you'll go over the rest of the workshop, how about one exercise that you love if someone is a regular runner?
Oh, that is so hard. Well,
you'll share the rest during the workshop.
Yeah. So I think if anything, and I'm sure so many people have seen this exercise, the clamshell exercise is one of my favorites. And whether you're a beginner runner or an elite runner, I like that exercise because when you do it properly, it helps to really reset your hip joint. When you do a clam, it's that exercise where you lift your knee with your knees bent. What it is the hip joint will roll into the pocket, and it's proper mechanics. So usually when I do a clam, or when I teach someone a clam, instead of instructing them to lift their knee up, I actually tell them to drop their hip into their pelvis.
Ooh, I like that.
That really gets all the hip joint nerves firing. So I really like that, just to, even like I said, if you're like a fast runner, it really kind of brings the body back. Like, okay, does your hip really have the capacity to do that? Yeah.
That's actually a hard exercise. It's like deceptively hard. It seems very Jane Fonda, but yeah, it is not easy.
I find it's like the dead bug. When people do it correctly, they're like, whoa, this is not what I thought it was. And I feel like the clamshell is the same way, when people have that cueing to really focus in on the hip. And I love that cue to drop your hip into the pelvis. That's awesome.
I really do think that a lot of exercises that we say is very simple and basic are actually very hard when you actually do it properly and use the appropriate muscles. you know, I've seen, and here's the thing is a lot of women are really strong. That's my biggest thing that I like to tell people. Women are really strong. And the only fault to that is then you can power your way through a lot of exercises. And so slowing down and really feeling what your body should be feeling in exercises can really just give you such a big benefit, especially like clamshells, dead bugs, leg lifts type of exercises. Those can be so beneficial. And I do see sometimes exercises get like very complicated.
Yeah.
It doesn't have to be complicated to be effective.
Yeah, at Straight Up Strong, we try to keep it simple. So we're totally on board with that messaging.
Yes.
The other thing, form is important when running. This goes along with alignment and posture. I feel like that correlates, right? But do you think that sometimes, especially beginner runners, could be over focusing on their form? Or like if there was going to be one or two things you would tell people to focus on, what would those be?
As in regards to form, yeah. So the biggest thing with that is just relax. I think a lot of people have been told like when you run, you should like be very tall when you run. But what happens is, I'm going to turn to my side, is that translates to, let me get this straight, that translates to this, right? That type of posture where like they think this is tall, when it should be more like you're tall, but you're more stacked up. Right?
Gotcha.
What happens, so many mechanical things happen with that. So I think what happens is when people are instructed to run tall, their whole posture kind of changes from it. And then a whole cascade of mechanical deviations can happen from that, just that cue of like being tall. So I say like run almost like relax so that the ribs kind of stack over your pelvis.
Yeah, that makes sense.
Yeah. And I'll go into further detail in the webinar about that.
Yay!
Excellent.
Way back in the middle. That is such good advice. So we know that the most common injury that you see is ITB and syndrome. And then relax when you're running is the biggest cue. And your number one exercise for runners, for all runners, beginners, intermediate, advanced, would be the clamshell, but done
hip down.
Hip down. Yeah. I'm going to try that. That's a really interesting thing, because I always think, oh, let me open the knee up. But that's interesting, like hip down into the socket.
Yeah, it's definitely a different feeling. So I'm excited to hear what you think about that different cue. Yeah.
I might be cursing you as I do it, because I'll be like, oh, so hard.
Yeah, it can be very challenging with that. Yeah.
Awesome. Well, I am so excited for the workshop on April 17th. It is a Saturday. It's at noon Eastern Standard Time, which is 9 a.m. Pacific Standard Time. And we're going to dig in a little bit deeper into all the topics that we discussed tonight. And
Janet will also kind of demo. So besides the queuing, she'll demo like what the clamshells will look like. Because I know in your reels, you always do such great little videos for runners.
Yes, I'll demo as many exercises, as many form cues as I possibly can. So, yeah.
And tell the people where they can find you so that they can go give you a follow and watch. I mean, I just learn so every time you post a reel or a video or any sort of post, I'm like, oh, this makes sense. This is what they mean by leaning forward when you, okay. You know, you're just so clear and articulate, and it's just so helpful. So tell the people where you live.
So glad to hear that. So I am personally located in San Jose, California, but you can find me on Instagram at 3D Runner PT. I have a website. It's the same, www.3drunnerpt.com. So
awesome. And you just opened a physical practice in San Jose, right?
Yes, I did. Yeah, and it's exciting. So
exciting.
Yeah.
So next Saturday, April, what day was it?
April 17th.
Yeah.
And it's virtual, so no matter where you live, you are able to participate. It will be interactive. And if you're not able to attend live, the recording's always sent out. That's always the number one question. So, use the link down below, register, and we can't wait to see you, and we can't wait to learn more from you then.
Hey, thank you. It was so great talking a little bit with you all.
Yay, thank you.
Thanks.